one thing?
What's one thing you want people challenged by pain to know?
In my book, that nutrition, what people eat, is part of the contemporary modern pain management message. We are nurtured by the food we eat.
I think sometimes they just need someone to listen to them and say, it's okay, this is awful, you're right.
I think people challenged by pain need to know that the most expensive treatments aren't always the best. There's a lot of things that you can do that don't cost a lot of money or are often free that have really strong evidence bases behind them. Don't be sucked in by fancy marketing.
So the great news is there's three main things with a lot of evidence that support the fact that they reduce pain in babies.
Well, actually, it's interesting because I went to some talks about the one thing and I loved it when they asked the researchers what their one thing was. And I went back into the clinic and I started talking to patients and I thought, hey, I'm going to ask them what is one thing that they could do to change just one thing, especially when I was getting a lot of no, I can't do that, no. And I'd say, well, look, there are some things. What would be one thing that you could do? And give it a try and come back and see me.
Most important thing that I would say is that you have got agency. You have got some element of control.
You are not alone, and there's always support or something to learn or some help along the way.
There are thousands of little things and everyone is different. So what works for one person is not going to be the same for someone else. But there are some commonalities.
I want people to know that it's not always a bad outcome. As somebody with a background of CRPS who ruptured an ACL in January, my immediate thoughts were the pain's going to go to my knee. I'm going to have CRPS in my knee now. While they are realistic thoughts, they're also catastrophic thoughts, and it's a real head trip, but it will not necessarily be a bad outcome.
Phantom limb pain is common. It is associated with various biopsychosocial factors, and it is best managed using an interdisciplinary approach.
The one thing I want people challenged by pain to know is breathing actually works. Try it, and try it again. And if it doesn't work, keep trying it, because what's the one thing that we need to survive in life? It's oxygen.
That it's also the clinician's responsibility to look at the language that they use to describe your pain, your diagnosis, and that language matters.
That we don't want them or their teenager to cross anything off their list of things they might want to do in their life.
There is something magical of closing our eyes and listen to someone that we trust, inviting us to change our emotional and cognitive processes.
What we're saying is that neuroscience shows that the things you think and the things you feel affect your pain 100% of the time.
I want to say that people living with pain, you guys are the experts. You are the experts of living with pain 24/7, 365. And you have got so much to offer for a clinician, for a researcher, for anybody. So we can learn from you guys, and you are the experts.
Nutrition matters for pain, whether it's what you eat or how you eat. Nutrition can play a really important role in helping you improve your pain experiences.
Both within countries and between countries, there are really big differences in people's opportunities to lead healthy lives. And many of these differences are avoidable.
One thing is that there's always light in the darkest of storms, and to find the light and to celebrate the shit out of it.
When you have chronic pain, in a lot of cases, it doesn't mean that there is a fire in the house.
There's this cyclical relationship between pain and mood, and that pain drives mood, but mood also drives pain.
I think the key message that you are not alone is super important from the clinician to deliver at possibly every interaction if they can, every touch point. It just is the message that's not said enough.